I had an athlete who was having problems with a knee issue, had run on cobblestone during a race, and that in turn had affected his knee, his hip, his low back. The patient actually had some bowing in his knees and wants to avoid any kind of knee replacement surgery, things like that. He's not an elite level athlete by any means, but very active, enjoys the activity, cycling as well. One of the things that we had to address was how his bowed knees impacted his ability to function properly with or without pain. So in putting him on a bicycle, we had him bring his bike in, put him on the bicycle, evaluate how his knees and ankles and hips moved while in the cycling position. And then also putting him on the treadmill, evaluating what muscles he's firing. Is he firing muscles in his glutes, or is he rotating from his hips? Is he engaging his hamstrings and quads and glute muscles, or is he walking by lifting and lowering his hips from his waist? Well, what we focused on was taking some of the lateral pressure out of the bowed legs, because when you do an activity, your legs should be, ideally the legs should be straight on top of one another, the thigh bone on top of the lower leg bone. Well, when someone's bowed and then you start impacting, there's this compressive force that puts more pressure on the medial knee. When that happens, you have to look at the true ergonomics for that person. And when you look at how to help that person to decrease some of that pain, how do we anchor it? What do we use for taping? What do we use for securing that knee joint? That's how we move forward to decrease as much as absolutely possible. We can't fix the bowed legs, but we can decrease the amount of impact during activity through impact absorbing insoles, through making sure that the footwear that they use is appropriate for the type of impact and the type of ground they're working on or doing their activity on. Making sure that the bike is set up appropriately so that the pedals move the way they're supposed to move and have the freedom of movement necessary to accommodate the bowed legs, to make sure the other joints are moving as efficiently as possible.